So this is our group. These are our amazing residents. We'll talk about all things UK, all things Lexington, and all things UK healthcare. Cool. So here's an outline of what we're going to talk about tonight. We're going to start off talking about the program, the schedule, our wellness activities that are scheduled and really run by Dr. Kipper and Dr. Hogenkamp, our wellness chair. Then talk about didactics and mentorship, because I think a lot of students, rightfully so, want to know what different mentorship opportunities are available. We'll also talk about our acute care hospital, our rehab hospital, Lexington, Kentucky, in case you've never heard of it, and then also talk about our Wildcat Wednesday series. So here's our program leadership. So Dr. Susan McDowell is our department chair. Our department vice chair is Dr. Sarah Salas. Our program director is Dr. Jamie Key. She's also our brain injury fellowship director. I am our APD and research advisor, and Leslie Justice is our program coordinator. And then we have these two rock stars, Dr. Kipper and Dr. Turner, are fantastic. They have done an awesome job in transitioning into their roles this academic year, and honestly, so excited to see what they do this year. So here is everything about our program. So we are a four-year categorical program. We also have an associated brain injury fellowship, and we are also one of three PM&R residencies that are osteopathically recognized, and we'll talk about that here later on in the presentation. We just recently had a complement increase of residents, so this upcoming match for 2026, we are excited that we will be matching 7 residents per year. We have grown exponentially in faculty and residents, and we're just stoked to be able to welcome 7 new residents this upcoming year. So what are some of the benefits? So I summarize this as to all the resources. So resources that you desire or want are all at your disposal, both electronically and in paper book. So you want the oral board, you give residents the oral board review text, Bradham, DeLisa, Cuperillo. We also have a UK PM&R online library. So all of these resources, as well as all pertinent journal articles that are outlined by diagnosis and different subspecialties, are all in one central location. So that's a real nice resource to have as you're doing research for, or you're doing like literature review for research, or if you're reviewing text for educational purposes. We also provide all of our residents with PM&R Recap. If you haven't heard of PM&R Recap, I like to think of it as like Pathoma, but for PM&R residency. It's an awesome resource. I know I used it when I was a resident back in the day, and we realized how many residents were using it, and so we provide all of our residents with that. We also give all of our residents a laptop and an iPad when you start. From PGY 3s and 4s, you get educational stipends that you can use for different resources. So one thing that people were using it for was PM&R Recap. So once we found out so many people were using it, that's why we now provide it. And so this stipend can be used for educational programs or resources that are going to help benefit you in your educational pursuits. From a conference standpoint, you get 3 sponsored conferences throughout residency. So we send all of our PGY 3s to AAP, all of our PGY 4s to AAPM&R, and then you also get 1 additional conference that is completely paid for by the residency. And so, for example, Dr. Turner is pursuing sports medicine, and he went to a sports medicine conference. Dr. Kipper is pursuing interventional pain, so we sponsored her to go to an interventional pain conference. There's also additional opportunities for conferences, which we'll talk about here in the next couple of bullet points. You also have scrubs and white coats, food stipends, and free parking. One of the big things here that I want to emphasize is all the residents have matched retirement. When I was in your shoes, I didn't think about retirement, and that was kind of silly on my part. But matched retirement is really important. And so this is a 2-for-1 match. So for those that are all financially savvy as residents, and also the faculty are also part of this, we put in 5% of what you get paid for your salary, and then UK matches it at 10%. You are vested after residency. After 3 years is when you're vested. And so because we're a 4-year residency, you are vested at the end of residency. And so you can take all of that matched retirement with you to wherever you go. And so that is a huge deal for all of those that look into retirement. A 2-to-1 match is really unheard of and is awesome that not only do faculty get to utilize that, but residents as well. We also have, health, dental, vision insurance, and what have you. For vacation and educational leave, so you have 15 working days, also 3 weeks. You also get 10 holidays and 4 bonus holidays. So these are the holidays that are recognized by UK. And if you're not working that holiday, you get that holiday off. Additionally, we have the Christmas and New Year's holidays as additional time off. So, for example, I happen to be working the New Year's week, and so I get off the Christmas week, and that is the same in residency. So, if you are maybe a second-year resident that is going to be on inpatient during the Christmas week, then you get an additional time off and you get that New Year's week off. And that is in addition to the 15 working days. For additional leave, you get 12 sick days per year, and that includes 2 wellness days. So if you need to take a wellness day, it's a no questions asked day. You just go message Leslie, our program coordinator, that says, hey, I'm taking a wellness day. And then again, no questions asked, you can take it. We also have, as everyone does, different maternity and paternity leaves. And then I want to focus on the educational time. So throughout residency, you get 5 career development days. So those can be used for interviews. Those can also be used for workshops or different career opportunities that are going to help you. And then you also get research days. And so let's say that you get research that is accepted at a particular conference. You get the day before your presentation, the day of, and the day after off. You don't necessarily get sponsored if it is outside, if it's in addition to the other 3 that you've done. But if you talk to our chair and have certainly a good reason of you're going to be an awesome representation with your research, there are other opportunities. But regardless, you get that time. In addition to all of the other research time, which I think is a unique part of our residency. Talking about UK GME as a whole. So these are the salaries for PGY 1s through 4s. In case you're not familiar with Lexington and University of Kentucky, it is a huge academic medical center. These numbers are just a touch old, but it's the most recent published that I could find for you guys. So there is a total of 661 ACGME residents and 72 ACGME accredited residency and fellowship programs. This QR code, if you scan it, takes you to the UK GME website if you want to take a look and see just what GME at UK is all about. So let's talk about some of the rotations. So as I mentioned, we're a categorical program. The first year is set up kind of like a transitional year. So you get 4 rotations, or rotations is synonymous with months. 4 months of internal medicine, 1 month of stroke and general neurology, 1 month of neuro ICU. You get 2 months of inpatient and outpatient orthopedics. You get 1 month of outpatient peds, 1 month of sports and pain, 1 month of trauma, and then 1 month of PM&R. One question that I always get is what is the administration's response to feedback from the residents? And I tell everyone to look at our first year. So our first year has continued to undergo adjustments based on the feedback that we receive from our interns. So for example, 2 years ago, instead of neuro ICU, all of our interns spent some time on the neurosurgery service. Those particular interns told us that, hey, the rotation just wasn't as beneficial. We met as PM&R leadership, we met with neurosurgery leadership, and we decided to change it up and go to the neuro ICU. Another example is the sports and pain elective here. So we know that sports and spine are very competitive fellowships and are very sought after for PM&R residents. And so we want to expose you guys early to that field to, 1, get that experience and see if you like it. And then 2, start to develop those relationships. And you get to start doing that day 1. For PGY2, so you spend about half the month inpatient and half the month outpatient. So you do 2 months of stroke and 2 months of brain injury. You get an elective for your PGY2 year. And then you also are in Cardinal Hill, which is our rehab, which is our freestanding rehab hospital. It's just our outpatient PM&R clinic. So PM&R clinic as well as our pain clinic. You also spend some time over at the VA in the musculoskeletal and polytrauma clinic. And then you're also in a hybrid rotation that has both inpatient and outpatient experience for amputee. Our PGY3 year is also split into having about half and half. So again, one thing I think is a little unique about our curriculum structure is, as opposed to having all of your inpatient or the majority of your inpatient during your PGY2 year, you get part of it your PGY2 and part of it your 3, which I think is a good thing for burnout because, right, you do a lot of, not as much anymore, but you do a lot of inpatient as a first year. And then as you go into second year, if you do all inpatient, by the time you're third year, you're a little burnt out of inpatient medicine. And so there's a reason behind the madness, and this is why we have it organized this way. So our third year is where you spend time on our spinal cord and general rehab units. You also go back to the VA and spend some time in the amputee and consult service. This is also where you get 2 months of peds rehab with Dr. Folks and Dr. Sin. They are 2 newer faculty that are PM&R, pediatric PM&R board certified physiatrists that are just awesome. And this is kind of a newer rotation for us. We did some peds rehab over at Shriners, and they're doing awesome work with the kids, doing injections in the operating room and being a part of multidisciplinary clinics with our neurology colleagues and other subspecialties. You also have an elective, and then you also spend some time on what's called TUT. So this is our teaching utility team. So the TUT team is meant to let you have the opportunity to see what it's like being a junior attending. So myself and Dr. Kipper actually just came off of the TUT service together. And, we sat down and we looked at pre-admission screens together. We talked about, why we felt that patients may or may not come to rehab. She got to see some of the administrative side of inpatient that you see as an attending. And so that's a real nice experience to kind of, stick your toes into the deep end and get that experience, especially if you want to do inpatient. You also have 2 months of another Cardinal Hill, so more Cardinal Hill clinics. And then you also have a month where you're on float. So a float rotation was newly introduced last year and has been exceptionally well received by the residents. So the float resident is essentially helping to, if we've got some vacations, then you kind of come in and help, plug in and help with, some of the work that they might be doing. And so it's a real nice kind of what I would say a quote unquote kind of chiller rotation where you get to kind of bounce around, see a little bit of everything, and has been really well received. Our PGY4 year is some time over at Cardinal Hill and at the VA doing EMGs. You also have our TUT service again. Then this is also where you're going to consults, your elective month. You have another month of float, and then another month of amputee rehab. So electives, what can you do? Well, you can do whatever you want. So if you want to do some time on sports, inpatient, you want to do a dedicated ultrasound or a spasticity elective. If you want to go and do an administrative elective, spending some time with the CMO and CEO, you can do it. So really, as long as you find it beneficial to you, you have a lot of freedom with electives. I mentioned that we are one of 3 PM&R residency programs that are osteopathically recognized. So we are so proud of this distinction and proud to offer this to residents. So this is an additional and separate curriculum from the PM&R didactics. So this is incorporating different like lectures, hands-on workshops. We also brought in the FDM course this past year, and we'll bring in the FDM course again for the next 2 years. So you have all of the FDM courses. You also get incorporated into our OMM clinic when you're on outpatient. And so if you really want to hone your skills in manipulation, this is definitely an awesome opportunity for you. Call. So PGY1 is in-house call only. For PGY2s and 3s, you have home call and weekend call. So home call is Monday through Thursday. And weekend call is Friday through Sunday. So someone starts on call on Monday at 5 p.m. and you're on call starting Monday at 5, Tuesday at 5, Wednesday at 5, and Thursday at 5. And you take calls at home on our upstairs and downstairs patients. And then on Fridays, when you pass off the call phones to the weekend teams, there's 2 weekend teams. You come in and you round with an attending. You do a couple of admissions if we have some, seeing patients on the floor. And then once the work is done, you can go and take calls from home. And then PGY4 is backup call only and also pump call. So we have a pretty robust intrathecal backup and pump program. And that's where our PGY4s will take call with a pump call attending. Our resident wellness, here's some pictures. I'm going to kind of speed through some of the last slides because I want to make sure I get to the last slide so you guys know some of the virtual opportunities that are available to you. Didactics are every Tuesday through Friday, 7 to 9. It's all protected. So myself and Dr. Key will cover your pagers. These are also separate from our OMM didactics, and we have an 18-month rotating schedule, so you get to see everything a couple of times. I want to draw your attention to our career development course. So this is where you get lectures on how to teach, leadership, finances of medicine, some stuff that is outside of the norm for didactics. Mentoring, there's 3 different types. So you have a research mentor that you get paired up with. I kind of help with that as research advisor. You also have a peer mentor through the peer mentor program that Dr. Kipper does as the wellness chief. And then you have your formal residency mentor. And then on top of that, you also meet with Dr. Key twice a year. So lots of different layers of mentorship here at UK. So some of the places that we do rotations at, your categorical PGY 1 year is at Chandler. It's the #1 hospital in Kentucky for the past 9 years. Unfortunately, or fortunately, you see some really, really sick patients and that teaches you how to be a really good doctor and a really good rehab doctor. And you can see all of these different distinctions that UK has. We are kind of a funnel system for the state. And so a lot of patients come to us, and a lot of those patients, like I said, are sick and need rehab. And then they come to us for that. Cardinal Hill is a 232 bed freestanding rehab hospital. One thing I want to mention is that we have 6 total diagnostic specific units. So when you're on stroke with me, you are only seeing stroke patients. When you're on spinal cord with Dr. Salas or Dr. Demick, you are only seeing spinal cord patients. And so they're very unique in that fact so that you can hone your skills taking care of patients with that diagnosis. And in my opinion, is just for better learning as you start to see some of the nuances with different diagnoses. Lexington, we are the horse capital. Could argue maybe with our UNC colleagues about some basketball, but I won't do that. And then you have some of the quotes from online: the 8th best city to live in and 3rd safest city. You want to go see the races, you want to go hiking, you want to see sports, you got it. One thing I want to close on is our Wildcat Wednesday series. So this is something we've done for the past 5 years that was birthed out of COVID. So this is kind of a introduction to who we are, but then also it's more than that. We want to help you guys succeed in this upcoming match. We know that at the end of the day, there will be 7 residents that match with us. So the overwhelming majority of you will be at other programs. At the end of the day, we're all pursuing the same field. We're going to be colleagues, and we take the part where we want you to be successful and be happy with where you want to be. And so we just had our first session on September 3rd. We're actually going to do a second one of those here, more information to come. But our next one is tomorrow night. And so we have 4 sessions total. So tomorrow night and the 17th and the 24th, we're going to talk about intro to applications in ARIS, talking about some interviews, I know Eris is right around the corner, and so these will just be some pearls for you as you're finishing up all of the documentation and all the things you need to. So we've got our social media channels in the bottom right-hand corner. If you want to sign up for Wildcat Wednesday, go ahead and scan that QR code, and that should take you to our Google Doc. Thank you, guys.